So I hope I've got the settings right. This is Charlie Smith, and I'm going to start talking to you about some issues related to healthcare. This first talk, I'm going to concentrate on a concept called participatory medicine. If I can get this set right, okay. I'd like to mention a few things about this very important idea and explain to you what I think it means and why I think it's important, and then what I plan to do with this project, which really was inspired by an article that I just read in Fortune magazine about a man named Salman Khan, who has started something called the Khan Academy, which is nothing more than a little over 1,600 videos that he has personally recorded about everything under the sun, including biology, physics, chemistry, history, and lots of other issues. And I would encourage you to get online and take a look at what he's done. It's really absolutely marvelous, and it's the whole idea is based on harnessing the power of the internet and its ability to communicate in such magnificent ways at such an incredibly inexpensive rate that the idea is that he can actually have a university online as opposed to having to go to a campus and go to classes and listen to all different types of lectures in person and so forth and so on. But at any rate, the idea struck me that it made a lot of sense to do some things like this online related to healthcare. And so I'm going to have some little talks with you based on my experience as a physician, excuse me, in practice for many years, and talk to you as if you were a patient in an exam room with me. And I think you'll find that there might be some good things that come of this. Excuse me. And I'll tell you just a little bit about myself. My name is Charlie Smith. I'm a physician. I work at the University of Arkansas for medical sciences. I'm a family physician, and also I'm an associate dean at the University of Arkansas. I also founded a company called eDoc America, and I am a co-editor of the Journal of Participatory Medicine. So I would like to encourage you to take a look at our websites. This one is edocamerica.com, and this is an online healthcare resource in which you can log on and ask questions of providers. In our list of providers, we have physicians, dentists, psychologists, dietitian, what else? Fitness expert, pharmacists. I think that covers it. So anyway, you can check that out, and also I'd strongly like to encourage you to check out the Journal of Participatory Medicine. And take a look at that. And through that, you can take a look at the Society of Participatory Medicine. And this is a movement that is just kind of getting off the ground. The idea being that this is a representative of a new world in which the patient is actually the driver of their own health care. And instead of having to rely completely on the physician for advice and orders, the idea is that we envision a world in which we level the playing field between patient and provider, so that they have a relationship in which they share, and that the patient takes responsibility for their own health care, with the physician or other healthcare provider being the facilitator and not the director, so to speak, or certainly not the sole director of their health care. So we believe that this new model of participatory medicine is absolutely essential for optimum outcomes of care. So what can you do? What can you do to become more participatory? I have trouble typing that word, sorry. Do things like get online and research conditions for yourself and make a list of your questions. Look at peer sharing websites. One really good one is called acore.org, Association for Cancer Online Resources, but there are lots of other ones where patients get online and just share their ideas with each other. Talk to your physician about emailing, communication between each other. I strongly want to urge that. I think this is the model of the future for communicating with healthcare professionals. So there's lots more to this, and another website that I'd like to leave you with is let's see, epatients.net, which is kind of a blog information about participatory medicine that I think you'll find interesting. So I'm going to go ahead and sign off here today, and then I'll be back soon to talk about some common conditions, and we'll see how this works. Nice talking to you.